Hey everybody, Dr. O here, and in this video we're going to be going over hormones that affect blood calcium levels and the skeletal system. So let's get started. So after this unit, what students are going to be able to do is identify the following hormones that are going to regulate blood calcium levels and bone metabolism. So let's move on to the next slide and take a look at these vocabulary words. Our first hormone is going to be parathyroid hormone, and this is going to be one of the hormones that will increase blood calcium levels. It will affect the bones, the small intestine, and the kidneys in order to make that happen. Calcitriol is going to focus on absorption of calcium from the intestines. And calcitonin is going to do just the opposite of parathyroid. In fact, it's going to lower blood calcium levels, and it too will affect the bones, the small intestine, and the kidneys to make that happen. Thyroid hormone promotes bone growth and development. Growth hormone also promotes bone growth, and it increases calcium retention in the bones. And our sex hormones, estrogen and testosterone, promote bone growth, and they help maintain healthy bone density. All right, so on this slide, we're going to compare and contrast our hormones as we continue to learn about them. And the things that we're concerned about is whether it's going to increase or decrease blood calcium levels and if it affects the bones. And I can tell you just from the beginning here that there are two hormones that are going to increase blood calcium levels, and it's going to be these first two, parathyroid hormone and calcitriol. And yes, they will also affect bone growth as a result. Now, calcitonin doesn't increase blood calcium levels, but it does decrease them, and it too will affect bones. Thyroid does not neither increases or decreases blood calcium levels, but it promotes bone growth and development. Growth hormone will not affect blood calcium levels either, but it does promote bone growth. And estrogen and testosterone, they won't affect blood calcium levels, but they do affect bone growth. In these next two slides, we're going to be looking at the mechanisms of parathyroid hormone and calcitriol, as well as calcitonin. Now, we know that parathyroid hormone is going to get released from the parathyroid gland when blood calcium levels are low. And this is going to go to the bones, and it's going to trigger the osteoclast to break down bone. The calcium that gets released goes into the bloodstream, and then that will increase blood calcium levels. PTH will also go to the kidneys and trigger the kidneys to pull calcium out of the filtrate that goes back into the bloodstream, and this too will increase blood calcium levels. And then the kidneys will release another hormone, which is calcitriol, the active form of vitamin D, and this is going to go over to the intestines, and it's going to encourage the uptake of calcium from the food that's moving through the intestine. That calcium will get dropped into the bloodstream, and that will increase blood calcium levels. Now, calcitonin is going to be released from the thyroid gland when blood calcium levels are high, and it's going to affect the same three organs that we saw with PTH, but the effect is going to be different. So in the bones, it's going to be the osteoblasts that are going to deposit calcium to the bone, and they're going to pull that calcium from the blood in order to do that, and when they do, that's going to decrease blood calcium levels. In the kidneys, calcium is going to remain in the filtrate. It'll enter the urine and be eliminated from the body, and in that way, we decrease blood calcium levels. And over in the intestines, calcitonin will have the effect of reducing the uptake of calcium from the food. Calcium will remain in the intestines, and as a result, blood calcium levels will decrease. I always like to include a graph comparing the actions of parathyroid hormone and calcitonin, so let's go ahead and do that now. Now over here on the left, we're going to have our blood calcium levels, and because they're going to change over the course of the day, down here at the bottom, we're going to include time. Now the thing that we know about blood calcium levels is that there is this ideal set point that we have for it. But like any physiological system, we're never going to be able to maintain a single point, but we will have a range that we consider normal. So we're going to include a dotted line that tells us that this is our upper range of normal, and we'll include another dotted line that tells us about the lower range of normal. And let's say that we're at the beginning of the day and we eat breakfast and it has some calcium in it. What we're going to see happen is our blood calcium levels are going to increase. And the thyroid is going to be acutely aware of these rising blood calcium levels, and as a result, it doesn't want blood calcium levels to go beyond what we consider high normal. So the thyroid gland is going to release calcitonin. Now, the two things we need to be able to say about calcitonin is that the trigger for its release is elevated blood calcium levels. The other thing that we need to say about calcitonin is that its effect is to lower blood calcium levels. So let's go ahead and make that happen. All right, and as our day goes along, we're going to see a continued usage of calcium out of the bloodstream. And so our blood calcium levels are going to continue to drop. And eventually they might come to the point where they get close to crossing over our low normal line. And the parathyroid gland is going to be aware of that. And as a result, it's going to release parathyroid hormone. Now, the two things we need to say about parathyroid hormone is that the trigger for its release is low blood calcium level, and that the effect of PTH is to elevate blood calcium. And so it does. So let's take a moment and put it all together. So here we have normal blood calcium levels. They are in balance, but what if things go a little on the high side? Well, that's going to stimulate calcitonin to be released from the thyroid gland, and that's going to affect the bones by causing calcium to be deposited from the bloodstream, pulling calcium from the bloodstream. We're going to release calcium into the urine, and we're going to resist the uptake of calcium from the intestine, and together all three of these are going to have the effect of lowering blood calcium levels and restoring normal blood calcium levels. But what happens if we have low blood calcium? Well, then that's going to stimulate the parathyroid hormone to be released from the parathyroid gland, and that's going to affect the bones by causing the bone to break down calcium that gets dropped into the bloodstream. It'll trigger the calcium to be reabsorbed from the kidneys. It'll also trigger the release of calcitriol, which will go over to the small intestines and trigger the uptake of calcium from the intestines, dropping that into the bloodstream, and together all of these are going to have the effect of elevating blood calcium levels and restoring blood calcium levels back to normal. And with that, we are done. Thanks for watching.